Kristen Bies is the Senior Director of Accreditation Readiness for Kaleida Health. She joins us here today on Medically Speaking. Kristen, thanks for being here.
Thank you very much for having me, Mike.
So let's first start out with your title and really what that means for the viewers out there who may not know accreditation or why accreditation readiness is important. Why don't you explain that to start off?
Sure, happy to, Mike. So accreditation really just means a continuous state of readiness. CMS has deemed organizations that are accreditation organizations in the country that really look at processes in the hospital systems just to make sure that everything is going as it should. With that, Kaleida Health uses DNV-GL healthcare, which is an international company. They have many sectors, one of which is healthcare. Along with that comes our ISO certification, which is a quality management standard that really looks at all of our processes and making sure they're integrated. It goes above and beyond the CMS conditions of participation to make sure that we're really integrated as a healthcare system. So one of my roles is to make sure that we're accreditation ready at all times with a yearly survey in which DNV-GL surveys us on a yearly basis to make sure we're kind of focusing on that accreditation readiness at all times. With that comes the ISO certification, in which my role is to make sure that the organization is ready at all times, looking at our internal audit processes to identify any risks and opportunities and also plan for changes that we can have throughout the organization at all times.
Kristen, I want to ask you about the ISO part of your accreditation. People may relate that to manufacturing or maybe the industrial world. If I'm a patient, why is ISO related to healthcare, and what would that do for me as a patient?
So ISO really is the ISO 9001 quality management system, is a set of standards that really looks at how the organization performs to continuously meet those patient expectations. So it takes us from a deep dive perspective, looking at all of our processes and how they interact, as well as how the departments work with each other so that we can continuously drive improvements. Now, the ISO quality management system is really an industry standard that goes across all types of industries. So healthcare, it's somewhat new in the healthcare field, but a lot of organizations are really embracing it to really drive continuous improvement, but also to go above and beyond to meet the customer's expectations, which of course are our patients.
Sure. So obviously, your role in accreditation readiness and dealing with your accreditation partner, DNV, certainly important. But, 2020 obviously has been the year of COVID-19. With all that's changed in healthcare, first, how has DNV helped either prepare you for that, or what role have they played as you've come into this accreditation survey?
So one of the things that DNV-GL touts in ISO, our ISO certification, is planning for changes. So it's really identifying those things that are maybe coming up, for instance, a pandemic, and putting processes and plans around those items to make sure that we're ready to go at all times. So that was the COVID and our emergency management plan, and with their infection control and prevention team, really being able to seamlessly move forward with all of those plans. It really was a testament to our ISO approach and the way we really take a very deep dive into all of our processes. And planning and risks and opportunities are those three things that really ISO really drives us to continuously improve upon.
I know this year was much different for the visit with DNV-GL. So if you can explain, how they performed the survey this year versus previous years.
So this year was a fully remote survey. Like many accreditation and certification organizations have moved to a remote survey process where our surveyors were back at home. We did a video Skype, and we had iPads and carts, and they were just like they were in our facilities. It was actually really remarkable, the breadth and depth of what they were able to survey. And it was just like any other survey. They were just happened to be remote. The Kaleida Health goal for accreditation every year is to close out all of our nonconformities. We were actually able to close all of our nonconformities from last year. And that wasn't luck. It was, again, continuous improvement. Quality and patient safety did not take a backseat during the pandemic. So DNV-GL recognized that the organization is safe and we provide excellent care. And by way of our focus on those nonconformities and creating a multidisciplinary team approach to address those and identify the true root cause of those so that we can create those sustainable action plans is really a testament to the whole organization's focus.
So as we wrap up here, is there any type of message that you'd like to send to the Kaleida Health organization, the workforce, or the community in general?
Yeah, so I would say to the Kaleida Health workforce, first of all, thank you. These surveys aren't a check the box and move on. And it's really, again, that team approach. And it's incredible the amount of integration and buy-in that we have from the medical staff, from the nursing staff, the ancillary support staff. When we have a third-party auditor come into our organization and validate the work that everyone is doing, it's really fulfilling. This yearly process of having an outside organization look at our processes is just, again, showing that we really deliver the best care and we lead with care within the Kaleida Health organization.
That's great. Probably a very little known process, but something very important to the healthcare system. Kristen Bies is the Senior Director of Accreditation Readiness for Kaleida Health. Thanks for joining us today on Medically Speaking.
Thank you so much for having me.